Within this lesson, we will be sharing a little bit about communication disorders. But I want to start by telling you a little story about Julia. Julia is probably as old as one of your parents nowadays. And this is what Julia has to say about her experience growing up with a communication disorder. My earliest memory is of sitting on the basement staircase of a Maryland house, churning my sister's peanut grinder. It was the coolest toy, and it made peanut butter. I was 2.5 years old. I wish that sweet and vivid memory was the first of a childhood filled with joy. But many of the memories that follow are a fear of getting lost, fear that I couldn't say my name or where I lived, fear that I would be alone and unable to communicate, and anger that no one understood me. I was born with a communication disorder, and I didn't speak my first words until I was 4 years old. The diagnosis that the doctors told my parents was that I had a neurological lag. I now know that what I had was a communication disorder, and I want to tell you a little about how it impacted me, my early struggles, the struggles it gave me through my life, my career, and how it changed the way I parent my 2 children with special needs. By the time I reached elementary school, I felt my differences. I was an outsider, and my school performance was poor. It's clear to me now. I had both an expressive and receptive language disorder that impacted the way I processed and organized information. When my teachers spoke, I felt like they were speaking a different language. Nothing made sense. And I basically moved along in school because of social promotion. I went to school in the 1970s, and special education in the 1970s didn't look anything like it does today. But I did receive speech therapy and worked with a special educator. As I entered my tweens, I remember asking my older sister if I could live with her when she grew up. I had found an evaluation from years earlier that said I wouldn't catch up to my peers. It was devastating to read. And I started thinking I would never be independent. How would I successfully live on my own? How would I ever get a job like my parents? Friendships for me were complicated. I had a few close friends in early childhood, but there always seemed to be an imbalance. My friends dominated our interactions, with me following along because I didn't know how to do it differently. Middle school, a painful transition for many kids, was excruciating for me. Those preteen years were the most difficult to navigate. Small kids can be brutally honest about differences, but they are often accepting. Tweens, in my experience, not so much. By the time I reached 6th grade, the differences between my peers and me seemed insurmountable. I became the object of humiliation and systemic bullying. The end result was that I was ostracized by other children. I turned to journal writing and reading. Upon reflection, I think my immersion into journaling helped propel me forward academically. I learned to process and sequence language and to organize my thoughts and my feelings. I felt socially isolated and vulnerable, but for the first time, I had a vehicle for my pain, other than screaming or biting one of my siblings. Writing was my outlet, and novels became my escape. These were the essential tools I would need to succeed in school. And I am emerged middle school inspired and hopeful. In high school, I was placed in remedial classes, but soon realized true boredom. Instead of being lost in class, as I was in elementary school, I felt detached from learning because the material wasn't challenging. High school was a real turning point for me. In my first act of self-advocacy, I asked my guidance counselor to transfer me into accelerated classes. Believing in giving me a chance, he supported my request. In the world of today's special education, we call that assuming confidence, meaning educators should give special needs children access to the general curriculum and coursework that some may see as a reach. My counselor assumed my competence and gave me access to a completely different track of learning. That one change altered the trajectory of my future, my education, and the course of my life. I continued on an accelerated track, and I graduated with my diploma. I wanted to write about overcoming my communication disorder in my college admission essay, but my guidance counselor, never perceiving me as disabled, encouraged me to write about my strengths instead. One morning, I walked in on a group of girls crying in the school bathroom. They told me my beloved counselor and advocate had died suddenly. I was heartbroken. He was the first person outside of my family to believe I was smart and capable. In that moment of grief, I realized my greatest strength was the journey I had traveled with my communication impairment. I wrote my college essay about finding my voice and how my learning differences were my gift. And I got into college. And now it's my turn to pay it forward, to share my story, and to support giving other people their voice as well. So what are communication disorders? Communication disorders are when communication is impaired or absent or qualitatively different, where the simplest interactions may become difficult or even impossible. Disorders in speech and or language can result in social problems and may undermine a student's self-esteem and confidence. And we need to remember that communication disorders are complex. There are many different types of communication disorders involving speech or language. So some basic concepts of communication and communication disorders. We can really think of them as speech and language disorders that can be considered within a broader context of communication disorders. So if we look at speech and language, these are interrelated skills. For example, the American Speech Language Hearing Association, the ASHA, includes a number of important items to consider. That language involves a specific historical, social, and cultural context. that language is rule-governed behavior, that language learning and use are determined by the interaction of biological, cognitive, psychosocial, and environmental factors, and effective use of language for communication requires a broad understanding of human interactions, including associated factors such as nonverbal cues, motivation, and social cultural roles. Now, Silverman and Miller suggested that a condition to be a true disorder should include there being something noticeably different about how the person looks or listens. For example, the communication difference interferes with communication, calls adverse attention to the person, or causes him or her to be self-conscious or maladjusted. That the communication deviation has to be regarded as atypical by at least one person whose judgment is respected by the individual. For example, a speech-language pathologist, an audiologist, or a family member. Now, there's different types of communication disorders. And so within the SHA's descriptions, there are both speech and language disorders. And their definition also describes hearing disorders and central auditory processing disorders. And we may take a look at those a little bit later on within the course. But first off, just looking at speech disorders. What are speech disorders? That really includes impairments of voice, of articulation, and fluency. And then there are language disorders. And this includes impairments of comprehension or use of language, regardless of the symbol system used. A language disorder may involve the form of language, the content of language, or the function of language. Now, there are some specific disorders of language, and these include phonological, syntactic, or morphologic impairments. There are semantics, and this refers to the content of language, and there are pragmatics. And this is the system controlling language function. And there are a large portion of all students with exceptionalities will have communication disorders, so we need to be mindful of that. There's significant prevalence and some good understanding of the causes of communication disorders. In Canada, for example, between 5 and 10% of school-aged children have some type of speech or language disorder. Now, the majority of them also have other exceptionalities, like learning disabilities, autism, or some other exceptionality. In the United States, the second most common disability category of students ages 6 through to 21 served under the Individuals for Disabilities Education Act is speech or language impairment disorders. So the prevalence is fairly significant. Speech disorders include problems in articulation, in voice, and fluency, as I've already mentioned. And all of these areas can create problems in the everyday lives of students, whether they're in school, in the community, or at home. Articulation and phonological disorders are really the most common speech disorders. Articulation is the ability to articulate clearly. and correctly. Articulation disorders occur when an individual has difficulty correctly pronouncing one or more sounds. Phonological disorders involve many sound errors that form patterns. And then there are motor speech disorders, which are articulation disorders that are a result of neurological damage, for example, head injury or a stroke or some other type of injury. Although some articulation errors are normal and acceptable at young ages, when students are older, these same errors may be viewed as unacceptable and problematic. By the time students begin kindergarten, their teachers and their peers should be able to understand them easily. Sometimes, though, that is not the case. Now, some of the most common types of articulation errors are distortions, substitutions, omissions, and additions. Speech impairment can be either organic, for example, having a physical cause, or functional, having no identifiable cause. Within organic disorders, when they arise, there is a difficulty in neurological or muscular interactions. Organic causes of speech impairments may include hearing loss, cleft palate, dental malformations, or even tumors. Brain damage and related neurological problems may also result in speech disorders such as verbal apraxia, which is a condition not due to paralysis or muscle weakness in which the individual has problems saying sounds, syllables, or words. And dysarthria, for example, muscles of the mouth, face, or the respiratory system may become weak. They may move slowly or may not move at all after a person has a stroke or a brain injury. So, there are various types of organic disorders. And then under the functional speech disorders, they may be related to the student's opportunities to learn appropriate and inappropriate speech patterns, including opportunities to practice appropriate speech, fluctuating hearing loss due to some disorder at early development, and the absence or presence of good speech models can play a role within that. Because we know the developmental patterns of normal sound production, we can recognize those children who have significantly different function from the norm. The normal pattern of consonant sound production falls within relatively well-defined age limits. The implication of this developmental pattern are that while it is common for very young children to make articulation or phonological errors, older students who make such errors may need to be referred for a speech-language evaluation. Now, when the general education classroom teacher is considering referring a student for a speech-language evaluation, there are a few things that should be considered. First, the teacher should take note of how understandable the student's speech is. They should consider how many different errors the student makes. They should evaluate whether the speech errors might have an impact on the student's ability to read and write, and observe whether the articulation errors cause the student's problems in socialization or in adjustment and functioning with peers, and consider whether the problems are due to physical problems. Now, there can also be voice disorders. And here there can be a voice disturbances, and some of these are quite common in children. So, voice disorders are characterized by abnormal vocal quality, of abnormal pitch or loudness or resonance or duration given individual's age and sex. An early diagnosis of voice disorders and intervention are warranted, as the disorder can lead to lifelong communication issues, and so it's important to catch this early. And sometimes it can be difficult to distinguish between an unpleasant voice from one that would be considered disordered. But voice disorders are not commonly thought of as prevalent or serious, and so sometimes they're overlooked. There are two basic types of voice disorders. The first one is phonation. The second is resonance. Phonation refers to the production of sounds by the vocal folds. Phonation problems occur when the folds do not meet and close together smoothly. When this happens, the voice is likely to sound buttery, or hoarse, or husky, or strained. Resonance disorders involve either too many sounds coming into the air passage of the nose, or the opposite, too little resonance of the nasal passage. So, when resonance has too many sounds, we call that hypernasality, and when there is too little resonance, we call that hyponasality. Hypernasality sounds like talking through one's nose with a twang. Hyponasality sounds like one has a cold or a stuffy nose. Voice disorders can result from vocal abuse or misuse, like shouting and screaming or talking loudly or making vocal sound effects and throat clearing. So trauma to the larynx from accidents can also result in this, or from medical procedures, or sometimes from congenital malformations of the larynx, the nodules, or even from tumors within the throat. Some common childhood health problems, such as an upper respiratory tract infection, or allergies, or asthma, or gastroesophageal reflux, can worsen some of these symptoms. So many students with voice disorders are referred to an otolaryngologist, so that would be an ear, nose, and throat doctor. And voice disorders may also be due to a functional problem. A student who has a voice disorder really should be observed for several weeks, since symptoms may be due to something that's temporary, or some acute condition like a cold, an allergy, or a minor respiratory infection. And teachers themselves are at higher risk for voice disorders than the general population, and so they too should practice some vocal hygiene, because when you're using your voice all day, things can become exhausted and injuries can occur. Questions teachers might ask before referring a student for evaluation for a voice disorder include some of the following. Is the student's voice having such an unpleasant effect on others that the student is excluded from activities? Is there a possibility that the voice disorder is related to another medical condition? Might the voice quality be related to a hearing loss? Now, speech language pathologists are trained to provide treatment for voice disorders. The management of voice disorders really depends on a number of variabilities. However, the first goal in the process of voice rehabilitation is to restore the condition of the vocal folds to normal. If that is not possible, then to compensate for whatever abnormality is present. So that's a voice disorder. Let's go on now to fluency disorders. Now, fluency refers to the pattern of the rate and flow of a person's speech. Normal speech has a rhythm and timing that is regular and steady. However, normal speech patterns also include some interruptions in speech flow. Often speech disfluencies are related to stress or demanding situations. So some of the key factors that distinguish normal from abnormal speech fluency include the frequency of their occurrence, the duration of individual moments of disfluency, the amount of tension present, and the speaker's awareness of and attitude toward moments of disfluency. Now, many young children, especially those between the ages of 2 and 5, demonstrate disfluency in the course of normal speech development. And most of these disfluencies disappear by the age of 5. Now, the most frequent type of disfluency disorder is stuttering, which affects about 4 to 8% of school-age children. Fluency disorders usually consist of blocking, repeating, or prolonging sounds. For example, mummy. Syllables, words. So, for example, but I want to, mommy. Or phrases. In stuttering, these interruptions are frequently obvious to both the speaker and the listener. Now, there's no one cause for stuttering. Currently, theories regarding the possible causes of developmental stuttering include factors such as language development, motor skills, personality, and environmental factors. Children who stutter are very vulnerable to the attitudes, responses, and comments of their teachers and peers. Some of these children may begin to have negative feelings about themselves and may become even more anxious and as a result stutter even more. Now, most students who stutter would benefit from intervention by a speech-language pathologist if they hope to avoid a lifelong problem, as that may affect their ability to communicate, to learn, to work, and develop positive interpersonal relationships. Speech disfluencies are a normal developmental occurrence in many children, so we need to keep that in mind. Now, teachers may want to ask themselves the following questions when they're deciding when speech disfluencies are serious. For example, are the disfluencies beginning to occur more often in the student's speech or beginning to sound more effortful or strained? Is there a pattern to situations in which the student stutters? Is the student experiencing social problems? Is the student concerned about their disfluencies? And is the student confident? All of these will help in making a decision. Now, there's some other recommended strategies that can be used for communication disorders. First off, you can help the student learn to monitor their own speech. You can pair students with peers to practice their speech. You can teach students positive affirmations and self-talk to help overcome the negative self-talk that often goes with a speech disorder. You can modify instruction and materials to help the student. All of these will go a long way to helping the student to overcome some of the emotional pain that comes along with these kind of speech disorders. Now let's move on and talk a little bit about language disorders. Language, remember, is a system we use to communicate our thoughts and ideas to others. So language is an integral component of the student's abilities in reading, in writing, and, of course, in listening. Disorders of language have a serious impact on academic performance. Now, in recent years, the field of communication disorders has shifted away from remediation of speech problems to an increased focus on language disorders. And teachers will often direct and manage the overall language development of their students in collaboration with the speech-language pathologist and other special education staff that may be required. Now, the modes of communication are generally described as either receptive language, and receptive language, of course, is involving receiving and decoding or interpreting language. So reading and listening are receptive language, or of expressive language, which is the encoding or production of a message. So, for example, writing and speaking. Knowing the normal sequence of language development is important in working with students with language disorders. Some children may be delayed in their developmental language, but still acquire skills in the same sequence as other children. Other children may acquire some age-appropriate language skills, but have deficits in other specific areas. So it's important to understand some of the dimensions of language. Some of the dimensions of language and their related impairments really can be classified in terms of form, of content, and of function. So let's just take a look at form first off. Form describes the rule systems used in oral language. And there's 3 different rule systems within the form of language. The first of these 3 is phonology. And here we have the rule system that governs the individual and combined sounds of a language. These rules vary from one language to another. So English vowel combinations are not found in some other language, say for example Spanish. Then there's morphology, and that's the rule system controlling the structure of language. So for example, prefixes and suffixes. Morphemes are units of meaning and can change basic words into similar words with many different meanings. And then we have syntax, and this is the ordering of words in such a way that they can be understood. Syntax rules determine where words are placed in a sentence. So there are rules governing negatives and questions and tenses. So that's the form of language, broken down into phonology, morphology, and syntax. Then we can go to the content of language. And this refers to the intent and meaning of language and its rule system. So, for example, semantics. And that deals with the meaning of words and word combinations. For example, when students fail to comprehend concrete and abstract meanings of words or the inferences of these words. And then finally, there is the function or use of language. And this is the rules that govern the use of language in social contexts and are known as pragmatics. So, for example, using respectful language or taking turns talking are examples of the pragmatics of language, which is under that heading of the function of language. Now, there are many causes of language disorders. Language disorders can occur due to medical problems, so hearing loss, for example, or sometimes we don't know what the cause is. And being unable to determine the exact cause of a language disorder does not adversely impact assessment or the intervention efforts. Delayed language occurs when a child develops language in the same approximate sequence as other children, but at a slower rate. Now, causes of delayed language include intellectual disability, hearing loss, lack of stimulation, or appropriate experiences and familial transmission. Sometimes language development is interrupted by illness or physical trauma. And this type of language problem is increasingly common among children as a result of traumatic brain injury. So in general education classrooms, teachers may encounter any or even all of these types of language disorders, ranging from very severe to very mild. Now, there's some indicators of language disorders. And we can kind of think about them in terms of by grade. So in the primary grades, problems in following verbal direction or difficulty with pre-academic skills or phonics problems, poor word attack skills, difficulties with structural analysis, and problems with learning new material are indicators of language problem disorders in primary grades. When we look at intermediate grades, problems with word substitution, inadequate language processing, and production that affects reading comprehension and academic achievement can be indicators. And in middle and high school, inability to understand abstract concepts, problems understanding multiple word meanings, difficulties connecting previously learned information to new materials that must be learned independently, widening gap in achievement when compared to peers are all indicators of language disorders within middle and high school. Now, there are many accommodations and adaptations that you can take with students with language disorders. The first thing that you need to consider are the ways of structuring learning situations and presenting information to enhance communication. One of the first things is to teach prerequisite imitation skills. It's also important to improve students' receptive language skills in the classroom. So increase the length of verbal directions for students to follow. To give students opportunities for facilitative play. To elicit language from students. to encourage students to talk with their teachers and their peers, to use naturalistic techniques and simulated real-life activities to increase language use, to encourage students' conversations through, for example, story reading, to use music and play games to improve language, to arrange your classroom for effective interactions, to use challenging games with older students, to modify strategies to develop students' learning tools, to work collaboratively with the speech-language pathologist and use storytelling and process writing. Now, there's also the use of newer technology programs and devices, to use selected computer software or mobile apps on different devices and tablets and smartphones in the classroom. Now, you should always keep in mind that when you're going to be using these specialized technologies, it's always important to discuss them with a special ed specialist or a speech-language pathologist to ensure that you are using the appropriate devices and programs for the students' disorders. Now, we always need to keep in mind as well that there are simple differences that sometimes take place within children when it comes to language. Children's patterns of speech and use of language are going to reflect their culture and may be different from that of their peers. And it's important not to mistake a language difference for a language disorder. Although a disorder must not be overlooked, variations in family structure, child-rearing practices, family perceptions and attitudes, and language and communication styles really can all influence a student's communication. So it's important to do some investigation to identify, is this a language difference or a language disorder? And it's because we're wanting to include diversity, we also need to be mindful of linguistic diversity. As an educator, you will encounter students within your classroom whose first language is not English. And these students may demonstrate difficulty using the English language in the classroom environment. And students and teachers need to be able to work together to recognize language differences from communication disorders to avoid unnecessary referrals. The teacher needs to be mindful to help the student to learn the classroom's language of instruction, which in most cases is going to be English, and to assist them in functioning in this environment. However, in Canada, educators work on and off reserves or in other communities. And so there will be opportunities and challenges of helping, for example, Aboriginal students maintain and develop their first language or the language of use in their community. And that needs to be respected as well, of course. Now, because we're talking about linguistic diversity and difference, we also need to remember that there is a relationship between communication style and culture. Culture has a strong influence on the style of communication. Many areas of communication style can be affected, and these can include gender or status or age roles, and there are many rules that govern interpretations and turn-taking use and the use of humor and how to greet someone or how to leave someone. And teachers must be aware of the many manifestations of culture in nonverbal communication. So the differences in rules governing, for example, eye contact. So, for example, in Confucianistic, strongly influenced cultures, it's inappropriate to give eye contact with someone who is of a greater status than you, who is older than you. Where it would be respectful in a traditional English community to give eye contact. That there can be differences in space between the speakers. There can be differences in the use of gestures and facial expressions and use of body language and use of silence. And all of these differences vary with the culture of origin. So there are some multicultural considerations that need to take place when doing a communication assessment. Okay. I'd like to just take the last few minutes and talk a little bit about how can we enhance inclusion in the classroom for students with communication disorders. Now, traditional service delivery model for speech and language intervention used to include regular pull-out sessions in which speech-language pathologists worked with students in a setting outside of the regular classroom. But a combination of intervention approaches can be effective when providing speech and languages services to students. For example, integrating services into the general education program. So classroom teachers and speech-language pathologists can co-teach or teach alternate lessons. And this may present several barriers, such as territorial obstacles, such as time concerns, or even anxiety on the part of the workers or students. But teachers and speech-language pathologists really do need to work collaboratively to overcome these barriers and to make the experience as integrated as possible, to normalize the student experience so that all students have an opportunity to overcome whatever challenges they may have and to be part of the full inclusive community. Now, within that, there are some trends that we're working towards in the future. One of those is that classroom teachers are really likely to see more students with moderate and severe exceptionalities due to this trend towards inclusion of the classroom. And this means that many speech-language services will be delivered in an increasingly collaborative framework. So it's important for teachers to be mindful of the role of other professionals within their classroom. And there's a lot of research that suggests a shift away from the use of standardized assessment instruments and towards a more dynamic and authentic and curriculum-based assessment tools for dealing with students with communication disorders. And finally, there are some social trends that are shaping our society that may also have an increasing effect on the provision of speech-language therapy services in the classroom. For example, increasingly multicultural and multilinguistic society means that there is a greater recognition of the importance of communication and adjustment within schools, and so there's a changing role of the school in the community. And finally, given the rapid advances in technology, students with more severe exceptionalities really are going to have an opportunity to interact and perhaps participate in activities that would have seemed impossible even a few years ago. And that is a wonderful thing. So just remember that, like that story that I shared at the beginning of this lecture with Julia, that these are people that have some real concerns. They desire to fit in, they want to succeed, and it's important for us to help them achieve that within the classroom. And I'll see you guys next week.